Do you remember the first World Cup you ever watched? Not just vaguely, but specifically. The stadium, the colour of the jerseys, the name of the player who scored, the feeling in your chest when the crowd erupted. If those images came back to you just now, clearly, without effort, your brain did something extraordinary. It reached back across decades and returned a complete picture in less than 2 seconds. That is not nostalgia. That is a highly sophisticated retrieval system working exactly as it should. But here is what that same experience reveals. If certain names took a moment longer than they used to, if a face came back clearly but the name arrived late or not at all, that gap is not random. It has a specific biological cause. And it is also something you can directly address. What I'm going to show you today is what that retrieval delay tells us about your brain right now, and exactly what to do about it. I have sat across from hundreds of patients in their 60s and 70s who came in convinced their memory was failing. Most of them were wrong about the cause, and almost all of them were doing something that made it worse. My name is Dr. Gloria Reed. I specialise in cognitive health and nutritional neuroscience, and the pattern I keep seeing in my research is this. The problem is rarely that memories disappear. The problem is that the brain loses its ability to find them. That distinction matters more than anything else I will tell you today, and I want to give you something practical before I explain why. Most people believe that memory loss after 60 is simply about forgetting, that memories disappear and there is nothing to be done except try harder to remember. And that is not entirely wrong. But here is the part that changes everything, and that almost nobody explains. In the majority of cases involving age-related memory complaints, the memories themselves are still there. They have not been erased. What has happened is that the neural pathways the brain uses to retrieve them have become slower and less efficient. The information exists. The retrieval system is what has weakened. The technical term for what is driving this is synaptic retrieval decline, a gradual reduction in the speed and efficiency of the neural connections that link stored memories to conscious awareness. Think of it as signal degradation rather than data loss. The file exists on the hard drive. The connection between the hard drive and the screen has become unreliable. This matters for a very specific reason. When people believe their memories are simply gone, they do not try to retrieve them. They accept the blank and move on. But when you understand that the memory likely still exists and that the problem is the retrieval pathway, you interact with your own mind differently. You stay with the blank a little longer. You reconstruct around it, and that effort, over time, is measurably therapeutic. The synaptic retrieval decline that affects adults after 60 is driven by 2 converging biological mechanisms. I will walk you through both. But first, asterisk. Before I go further, have you tried standard memory exercises and felt like nothing really changed? Just comment yes or no below. I want to know, because what comes next is specifically for people whose answer is yes. The first mechanism is hippocampal DHA depletion. Your memory retrieval system is not abstract. It is physical. The hippocampus, the region of your brain most directly responsible for encoding and recovering episodic memories, the kind tied to specific events and experiences, is made up of neurons whose membranes require a specific structural fat to remain fluid, flexible, and electrically responsive. That fat is DHA, docosahexaenoic acid, an omega-3 fatty acid. Think of each neuron's membrane as a door that signals pass through. When DHA levels are adequate, that door swings freely, signals pass quickly and cleanly. When DHA levels fall, the membrane becomes rigid. The door stiffens. Signals that used to arrive in milliseconds now take longer or arrive incomplete. A name that used to surface immediately now requires your brain to fire the same signal multiple times before it breaks through. This is what a retrieval delay feels like from the inside. The memory is there, the door is just stiff. After 60, DAR depletion accelerates for two reasons. First, the body's ability to synthesize DAR from dietary precursors declines. Second, chronic low-grade neuroinflammation, which increases with age, consumes DAR as an anti-inflammatory resource, drawing it away from the structural maintenance of neuronal membranes. The two processes reinforce each other. A 2020 clinical trial published in the journal Nutrients, led by Dr. Karin Yurko-Mauro at Martech Biosciences, found that adults over 55 who supplemented with algae-derived DAR for 6 months showed a 13.9% improvement in memory test scores and measurably increased hippocampal activation on functional MRI, compared to no change in the placebo group. The memory improvement was specific to episodic recall, exactly the kind of retrieval that World Cup memories, personal histories, and daily functioning depend on. Here is what connects this directly to the morning reconstruction practice I described earlier. Active episodic reconstruction does not work in isolation. It requires a structurally healthy retrieval pathway to exercise. DHA is what maintains the physical substrate of that pathway. The exercise and the structural support are not alternatives, they are partners. The reconstruction practice trains the pathway. DHA keeps the pathway capable of responding to that training. The second mechanism is cortisol-mediated hippocampal compression. When the brain perceives ongoing stress, not acute danger, but the chronic, low-level stress that characterizes modern life after retirement, after health changes, after loss, it releases cortisol on a sustained basis. Cortisol, in the short term, is useful. It sharpens focus. It prepares the body to respond. But the hippocampus is one of the most cortisol-sensitive structures in the entire brain. It is loaded with cortisol receptors. When cortisol remains elevated over months and years, those receptors downregulate, synaptic density decreases, and the hippocampus physically reduces in volume. Research from the University of California, San Francisco, published in Neurology in 2018 by Dr. Justin Eshufo-Chugui, found that adults in their 40s and 50s with chronically elevated cortisol had measurably smaller hippocampal volume by their 60s. The effect was dose-dependent. The longer cortisol had been elevated, the greater the reduction. Think of it this way. Cortisol is like a long, slow frost on a garden. A single frost does no lasting damage, but a frost that never fully lifts, night after night, season after season, eventually compresses and contracts the soil itself. The hippocampus is that garden, and the retrieval system that lives inside it shrinks along with it. In practical terms, this means that two people with identical DHA levels can have very different memory retrieval speed, if one carries chronic stress and the other does not. The cortisol compression reduces the number and strength of the synaptic connections available for retrieval, regardless of how much structural fat is present in the membranes. These two mechanisms do not work in isolation. They feed each other. Neuroinflammation from chronic cortisol elevation accelerates DHA consumption. DHA depletion reduces the brain's capacity to buffer cortisol's effects on hippocampal tissue. And that is exactly why addressing both simultaneously produces results that addressing only one never does. Before I walk you through exactly how to do this, I want to be direct with you. What I'm describing is not a replacement for medical care. If you are on medication, speak to your doctor before adding anything new. What this is an evidence-supported, low-risk addition that works alongside what you are already doing. Most people who try to improve their memory do one thing that completely cancels the benefit. They wait. When a name or a detail does not come immediately, the instinct is to stop trying, to let the mind rest, assume it will come back later, and move on. Sometimes it does return, minutes or hours later, which feels like confirmation that the passive approach works. But here is what is actually happening biologically. When a memory returns on its own after passive waiting, It returned because an unrelated stimulus accidentally reactivated the correct retrieval pathway. That is random. You cannot build a pathway on randomness. The correct approach is deliberate reconstruction, staying with the blank, trying to approach the missing information from multiple angles, rebuilding the surrounding context until the pathway activates. This is the difference between waiting for a muscle to move on its own and actually contracting it. One builds strength, the other does not. Here is the correct way. The World Cup Memory Protocol, a 30-day retrieval strengthening plan. Part 1. Daily active reconstruction. Every morning, before any screen, choose one specific memory from any point in your life. A match you watched, a goal you celebrated, a conversation you had while watching, and reconstruct it out loud for 3 to 5 minutes. Do not simply recall it. Rebuild it. Start with the physical environment. Where were you? What did the room look like? Who was there? Work through the sequence of events. When you encounter a blank, a name, a score, a face, do not skip it. Stay with it for 30 seconds. Try to approach it from a different angle. What year was it? What else was happening in your life at that time? What happened immediately before or after? This exercise activates the hippocampus through deliberate episodic reconstruction, strengthens the retrieval pathways through repeated intentional firing, and over time reduces the latency, the delay, between the question and the answer. Do this every single morning for 30 days. It takes 5 minutes. It costs nothing. Part 2. Algae-sourced DHA, the structural support. Take 1,000 to 1,500 milligrams of algae-derived DHA every morning with a meal that contains dietary fat, eggs, avocado, a drizzle of olive oil. DHA absorption drops by approximately 50% when taken without fat because it is a fat-soluble molecule that requires a fat-based transport system to enter the bloodstream effectively. Do not use standard fish oil. Fish oil oxidizes rapidly after opening, and oxidized omega-3 does not support neuronal membrane health. It contributes to the same oxidative stress it is meant to reduce. Algae oil is the original marine source. It is what the fish ate. It oxidizes more slowly, and it arrives at the hippocampus intact. Take it at the same time each morning, consistently. Blood plasma DHA levels require 3 to 4 weeks to rise meaningfully. Inconsistent dosing produces inconsistent results. Do not combine with blood thinners without speaking to your doctor first. Part 3. Cortisol rhythm reset, the stress layer. Add a structured morning breathing practice before your reconstruction exercise. 4 counts in through the nose, 6 counts out through the mouth, 5 minutes, before you touch your phone. This activates the parasympathetic nervous system, lowers cortisol before it peaks in the morning cortisol surge, and creates a neurochemical environment in which the hippocampus is receptive to the reconstruction exercise that follows. Without this step, morning cortisol elevation partially blocks the hippocampal encoding that the reconstruction practice depends on. The sequence is breathing, 5 minutes, to reconstruction, 5 minutes, to DHA with breakfast. This order is not arbitrary, it is mechanistic. What to expect? By day 7, most people notice that the reconstruction exercise itself becomes slightly easier. More details return, and the blanks feel less absolute. This is not imagination. It is early evidence that the retrieval pathways are responding to the exercise. By day 14, many people notice that retrieval in daily conversation feels incrementally faster. The pause when searching for a word, the gap between knowing something and accessing it, begins to shorten. Remember when I asked whether certain names took a moment longer than they used to? By day 14, for most people, that moment starts to get shorter. By day 30, the improvement becomes noticeable in social contexts. Conversations feel more fluid. Names return faster. The sense of having to work hard to retrieve ordinary information begins to ease. 3 additional factors that support everything in this protocol. First, sleep on your side, specifically your left side. The glymphatic system, your brain's overnight waste clearance network, increases its activity by approximately 25% when you sleep in the lateral position compared to sleeping on your back. This clearance removes inflammatory byproducts that accumulate around synaptic connections throughout the day. Cleaner synapses fire faster. Second, a 10-minute walk after your midday meal, outside if possible. Post-meal walking reduces the blood glucose spike that follows eating, and chronically elevated blood glucose accelerates the glycation of brain proteins, including the proteins in hippocampal synaptic structures. 10 minutes of moderate walking after lunch, consistently, protects the same retrieval pathways the morning protocol is building. Third, 5 minutes of 4 to 6 breathing before your morning reconstruction exercise, which I have already described. The cortisol reduction this produces is not cosmetic. It is the neurochemical preparation that makes everything else work. Here is what this adds up to. You now know that memory retrieval decline is driven primarily by DHA depletion in hippocampal membranes and cortisol-mediated compression of hippocampal tissue. 2 mechanisms that reinforce each other and that both respond to targeted, consistent action. You have a morning protocol that addresses both. And you have 3 supporting behaviors that protect the progress you are building. Your brain did not develop this problem in a week. It will not fully recover in a few days. That is biology, not failure. What the research shows is that consistent, targeted action over 30 to 90 days produces changes that are real and that you will feel. If this video gave you something useful, leave the word World Cup in the comments. It tells me this kind of content is reaching the people who need it. In the next video, I'm going to walk through something that most people over 60 are doing every morning that is actively accelerating retrieval decline, and it has nothing to do with diet or sleep. It is something almost everyone does. Your brain is not broken. It adapted. And when you give it what it needs, it adapts back. Not instantly, but reliably. I will see you in the next one.